Next tonight, a neurosurgeon in Leeds who has pioneered a procedure in the UK to help children walk more easily has just carried out his 100th operation.
Now, the surgery, which is so intricate, involves cutting nerves in the spinal cord and helps children with cerebral palsy whose legs muscles are constantly stiff. Now, this special report by our health correspondent Jamie Coulson contains images of surgery from the start.
So what I've got now is the initial view of the nerves with the tip of the spinal cord just here and the sensory nerves there and there.
For 6 years, John Goodden and his team in Leeds have been changing lives. They treat children with cerebral palsy who struggle with movement. This highly complex surgery on the spine helps those children to walk.
It makes a difference to their walking, but it also makes a difference to their ease of movement and the amount of pain and stiffness they've got in their legs.
If I stretch again.
For children and their families, it can make a world of difference.
We're hoping that she can go out with her friends like a normal girl and go to school and have a normal life, you know.
But this procedure is high risk.
If I cut the wrong thing, I can paralyse this child. So it is very sensitive and very delicate. Cutting 1, keeping 3.
Good girl.
5-year-old Shayley Bennett was born with cerebral palsy, which causes the muscles in her legs to be constantly tight. These foot braces help her to walk, but the condition leaves her quickly exhausted and sometimes in pain.
She's always got bruises up and down her legs where, you know, if they're going for lunch break or something, all the kids run out the classroom, she always gets knocked over and things like that.
It's a balance as well.
Balance is really, really bad, it is.
Can you relax? Does that feel funny?
Shayley is about to become the 100th patient at Leeds Children's Hospital to undergo an operation called Selective Dorsal Rhizotomy. It involves making a small opening in the lower back to reveal the spinal cord and lower nerves which transmit messages to and from the brain. Specialist nerve monitoring is then used to help the surgeon identify and cut the sensory nerves responsible for most of the muscle stiffness. This allows the muscles in the legs to relax, making walking much easier. Once the operation has begun, it takes about an hour to expose the spinal cord. The next critical phase is to isolate the sensory nerves from those responsible for movement. To do this, John is guided by another doctor with nerve monitoring equipment.
And now motor.
Nothing yet, starting to come through. Lots of them there, lots of them, yep.
They look the same. If I cut the wrong nerves, if I cut the movement nerves, I will paralyse her. So it's really important to get it right. I don't get a second chance. Ready for test?
Stimulate now.
Next, they go through the sensory nerves one by one and identify which bits to cut. It's a methodical and painstaking process.
Cutting 1, keeping 3.
Today is exactly 6 years to the day since John first carried out this procedure here in Leeds. It is now available at 5 hospitals across England, but the work that he and his team have done here has been instrumental in it being made available on the NHS. The operation lasts for 2.5 hours.
Shayley, you okay?
5 days later, Shayley is on the ward and recovering well from the operation.
Does that feel different? Good. If I do that. She's got a very good range of movement. When she stands up, she can get her feet flat to the floor. Is that all right? You're going, aren't you? Look at you. And when she's taking those steps, she's taking them with a good heel contact when she first takes those steps forward.
These are early days, but Shayley should now go from strength to strength.
It's not nice sending them off for an operation, but yeah, I'm really pleased.
This isn't doing something that works for the next 6 months. This is something that works for the rest of their life. And being able to see that is just amazing.
Do you feel excited? Yeah? Do you feel happy about it? Yeah?
These may be small steps, but for Shayley, this will make a big difference. Jamie Coulson, BBC Look North.